Well, welcome back, everyone. As we go into this final session for this afternoon, we're going to be changing our focus to what motivates donors and what they can tell us about the future of aid for strengthening food and drug regulatory systems. So we're going to start out this afternoon, Santiago Cornejo, who will be talking with us about Gavi transition financing, and he is a senior specialist with Gavi. So welcome.
Thank you very much, and thank you very much for the Academy to host this meeting. I think this is a very relevant issue for us at Gavi, and one that we actually encountered that through our work in transition, that perhaps we were having a very narrow focus or a narrow view or investment in this area. Now, hopefully, some of these points will come through my presentation. Also, what I would like to have is a disclaimer. I'm not an expert on regulations. I don't know much about regulations. We have been involved mainly through the transition work, which is something that I have been involved in Gavi since the beginning of this approach. But having listened to this morning, what I have realized is many of the things, or the issues, challenges, and opportunities that you have been discussing this morning is some of the ones that we have been seeing in the work on transition. So basically, countries tend to face various programmatic and financing challenges at the different stages of the developments. And this is how in the Gavi model, where if we look at economic growth, that, countries in the lower end of the economic growth, they have weaker health systems and immunization systems, given that Gavi mainly works in immunization, and of course have more acute fiscal constraints. As they develop, the systems get stronger. However, they still have some institutional gaps. There is a growing domestic resources, but inadequate allocative efficiency on how to use those resources and how to prioritize. As they continue to develop, they get stronger, greater performance, some gains might be at risk, and more important, there is this work on how do you find greater efficiency and to achieve the same impact. Now, what is important to understand is this is just a conceptual framework. These are not absolute categories, but what we have seen, at least in the first set of countries that have gone through, the first wave of Gavi countries that have gone through our transition, that they have been moving along around these developmental stages. Therefore, in this, having that in mind, basically our early engagement is about building those foundations for sustainability. Then, how do we prepare them for transition? What we have seen now is this need on how do we continue to engage in this post-transition phase. Now, the tools that we use, we provide with finance health system strengthening. We also provide technical assistance through our partners, Gavi, as a secretariat. The Gavi Secretariat is not a technical agency, but we are an alliance and we work with WHO, with UNICEF, with the World Bank, and also civil society and private entities to help and provide technical assistance to countries. And then the third element of our model is a co-financing model. We don't fully finance, we request countries to finance. And so as we continue to move, then of course some of this support continues also evolves with the continuum development. Our health system strengthening continues, but perhaps diminishing our support for recurrent activities. In addition of the technical assistance, we provide some targeted support for transition, and of course a growing co-financing requirement, given that some of these countries have growing fiscal capacities. And now what we have seen, of course, that as they move away from our financing, still there is some need for targeted assistance to mitigate some risk, more is very specific, and of course some continued support more for transformational activities on the efficiency area and on the issue of pricing and vaccine procurement. And then we have our co-financing, and this is how it looks, our co-financing and we use the eligibility threshold that we use GNI, and countries increase their financial contribution. Now, therefore, when we look at our approach toward transition, we have three key components. One is that is financing, but also programmatic sustainability. What we have seen is that domestic financing is very important, but it's not enough. Actually, what we are seeing is that the programmatic sustainability requires critical national capacities, budgeting and planning, procurement, and regulation, among many others. Therefore, also the second component is how do we integrate the sustainability in the design of our support. We need to get the sequencing right, particularly addressing those systemic bottlenecks early on, and then how do we, and adapting the support to the different stages of transition. For example, as I mentioned before, reducing the recurrent support that we provide for recurrent activities. And then the final element is to conduct this transition assessment and plans to mitigate those risks. This is something that we introduce, that basically countries, before they enter that last phase of transition, we conduct assessment with our partners and the countries, and then we identify what are some strategies that could be implemented to mitigate some of this risk. And this assessment needs to be done in a more holistic way. We have started very narrow from immunization. Very soon we realize that it's much broader, that requires engaging with not only outside the program, outside with looking at other programs, but outside the Ministry of Health, looking at different stakeholders. And this is where when we started to do this transition assessment, when we realized the issue of regulations, we were underspending or not focusing enough in terms of strengthening some of these capacities. So we have 16 countries that have already transitioned and 9 that they are still in the transition phase. And here you have it. Those in green have already transitioned. Those in light blue are transitioning from Gavi support in the coming years. Now, what we have seen is that so far those have transitioned have been able to sustain performance. Coverage have not decreased in those countries that have already ended Gavi support. In terms of financing, what we have seen is significant investment from countries. They have increased their investment by 400% in terms of domestic resources towards the purchasing of vaccines. And with some catalytic support, they have even been able to introduce other vaccines outside of the ones being financed by Gavi, like HPV and measles. We do provide support for HPV, but these countries that transition were not entitled. So what was interesting, and this is some of the lessons learned that we have, is that even in those countries where, in terms of performance from an immunization perspective, they were they had high performance, there is still a need or a role for engagement in post-transition. One is around pricing. How do we ensure pricing will continue for some of these countries? The second is how do we help to introduce new technologies? Not to finance, but perhaps some catalytic funding to jumpstart the introduction of some of these technologies, in our case, vaccines. And the third is how do we provide some kind of targeted special assistance for very specific risks that might be identified in some of the countries. And creating this enabling environment is what we have seen as some of the critical issues that is beyond the financing that we have provided in order to ensure that sustainability after our funding supports. Now, when we look at the regulatory aspects, why? Well, of course, vaccines being biologicals, we need to ensure the quality, the safety, in order to access ensure the availability and the access. This increases the demand from the population, but also we need predictability, transparency, and competition from the supply side to have that virtuous cycle that will enable to provide these vaccines. And here's where the functional NRA is critical in all of the different functionalities that they have. Now, of course, some of those functionalities will depend on how do they do their vaccine procurement according to WHO. Now, interesting enough, and this is the different level of functionality depending on how they procure, and this was discussed this morning about using UN agencies as procurement, and this is what Gavi does when we procure, when we provide our support. We go through UNICEF or PAHO revolving fund in order to procure the vaccines. And what we have found out is that most countries where we did not have even a functional NRA, even to what was required for using the UN agency. In fact, only 9% of the countries that were procuring through this UN in 2014 had a functional NRA, compared to those that were producing vaccines. And one of the reasons, at least from the Gavi perspective, because all of our investment, again, our support to WHO in terms of pre-qualification, was focusing on those countries that were producing vaccines, because we wanted to ensure that they have the quality NRA. But then we realized that those countries that were phasing out did not have the national systems to, based on what they needed to do that role. And in fact, when we did the transition assessment, we realized that in all of the countries there were still areas to improve, not to get the full NRA, even the functional base to what they need. And 90% of the countries, we have to develop tailored support or activities to help strengthen the NRA. Because what are some of the risks that we saw in transition? Well, one, of course, as we were providing the vaccines through the UN system, one of the questions was, well, there was no longer this mandatory requirement to use pre-qualified vaccines. So how do you ensure that you have a system that will require quality vaccines? Not only that, being biologicals, knowing that there will be an adverse event following immunization, how do you have that pharmacovigilance available? How does that follow up? How does the government able to respond to some of those situations and provide the assurance to the population that these products are safe? Not only that, but developing those regulatory systems that they also don't become a bottleneck for the procurement system, that they don't create longer-term heavy process, bureaucratic process that limit competition, that will limit then the ability to get the better pricings for some of these products. So here I just highlighted some of the areas that we have been involved, therefore, in some of these countries as they transition in terms of the technical assistance. As you can see, it ranges from it's a wide range of areas, from updating guidelines, SOPs, to strengthening human resources, capacity building, particularly vaccine registration, market authorization, to modernize the registration process, training on EFI monitoring, and also, of course, equipment. One of the areas also that we have been looking, and through that, of course, this is with WHO, is how do we partner countries? And this we have tried Bhutan, one of our transitioning countries, which is a very small country. So how do we partner with Thailand and to see how the regulatory agencies can talk to each other and create some kind of agreements? As we move forward, of course, we need to continue to engage, and Gavi will continue to support some of these the countries that are producing vaccines and those that are transitioning, as this is an urgent need. However, we need to start looking at how do we engage early on? How do we really work with countries early on to strengthen some of these capacities so they can tap to some of our resources, particularly around health system strengthening and technical assistance? Was again quite surprising, even within the immunization, that everyone understands that it's a biological that is important. When we do a bottom-up approach, countries define their own priorities for health system strengthening, for technical assistance. Strengthening regulatory agencies is not one of their priorities at all. So how do we advocate? How do we ensure that this is so we can really start working on this? Also, I feel, and this was discussed this morning, we need to continue to explore different ways to support, looking at more regional and global opportunities. Of course, there is a national mandate, but when we look at some of these countries, for example, this is, I was mentioning Bhutan, very small countries. What do you expect in terms of what could be expected in terms of countries with very low capacity and very small resources? And this is also, we are also financing this regional approach that was discussed this morning with the Gates Foundation. We are providing funding to WHO and the World Bank to work on how do we can harmonize regulatory process in Eastern Africa. Also, we need to look how do we bring the different communities together. It was, again, quite interesting where our regulatory work was one work stream, our procurement work was completely separate work stream. How do we bring them all together? Again, to leverage opportunities, to advocate together, and to really see this in a more holistic way. And this is something that we are going to be exploring. And we're also even exploring to look at how do we talk with other agencies beyond vaccines and immunization. Now, just to summarize then, some of our important lessons is, of course, that when we from us, when we look at sustainability, is financial and programmatic. And actually, to support the development of national institutions is critical for the programmatic sustainability. What we have found, which was a surprise for us, was that financing is not the main bottleneck, the fiscal capacity. And for us, since we are a funder, we thought that the main bottleneck of transition, the main concern, was going to be the fiscal capacity, and it was not. What we found that actually one of the critical elements was about developing, strengthening those national institutions. And I think here we need to do a better job. We haven't done a good job as a global community. This is not about the regulatory agencies or areas. In general, I don't believe we have done a good job in developing, helping to strengthen institutions. We have spent significant amount of money in workshops, trainings, consultants, but I don't believe we have really helped to develop national institutions. So how do we do this? And I think Dr. Guzman mentioned something this morning which I think is quite important. Therefore, we need early engagement and planning. Do we have those plans? Do we encourage to have those plans, and that we all align, that we all support in order to strengthen some of these institutions? And the last is, while we need to be predictable and transparent, how do we support, how do we engage? I think we need to look, how do we leapfrog? We talk about this morning, about the regional approaches, the global approaches. How do we leapfrog? How do we use technology in a very different way? I think this is one of the key elements. And what the other, which I did not mention, but I think it goes to the critical, we talk about data. We talk about the need to have evidence, because it's about political will. How do we create the political will? And as it comes, it could come from very different angles. The morning they were talking about trade, how trade was an open window. Transition for us, while on one hand is being seen or has been seen for countries as something that is negative, actually has opened the window for us to engage in this dialogue, for us to support and to focus more on some of these areas. And therefore, we need to look at how do we look for those opportunities in a more flexible and innovative way. Thank you very much.
Before you leave, are there any questions? Let's take one question. Okay, Veronica.
Thank you very much for a very interesting presentation. Just one clarification question regarding the requirements. You talked a little bit about institutional development plans that was mentioned in the prior discussion. Are there any requirements that Gavi puts in order to say, if you not invest in A, we cannot go further on, or something like that? So in other words, what do you do from your side to incentivize countries to strengthen regulatory authorities, apart from what you mentioned that comes from Gavi, which is capacity building, etc.?
In terms of requirements from our side, the requirements that we have is that they need to be pre-qualified vaccines through WHO or through a regulatory agency that meets the WHO standards. So in that sense, we have. But one of the issues is, while they are part, if you want to say, of our support, those requirements are valid. But what we realize is we need to work on what are the requirements internal, irrespective of if they receive Gavi funding or not. And this is the area where we felt that we needed to invest. And the other issue that is linked to something that we are now discussing within Gavi is perhaps one of the areas that we need to look particularly around this programmatic sustainability is, because our current eligibility angle is only purely from a financial point of view, do we require some readiness that Gavi will support until it reaches certain readiness? And therefore, what that readiness will look, and this will come to some of the issues about from a regulatory, from a procurement, from a program management, what are some of theirs? And this is some of the things that we are now discussing with our partners of what that readiness will look like. So every country will achieve that status before the end of our support.
Great, thank you. We'll have time for more questions when we get to the panel discussion, but thank you very much.